Yo, what's good? What's good? This your boy Solo Man. This is What's a 9 to 5 podcast, and what we now got actually the first female that was on this podcast that's doing an important job. But I'm gonna let her introduce herself. And you introduce yourself.
Alrighty, so hi, my name is Natalie. I'm one of the, volunteers of talking about what's a 9 to 5.
And so how I act. Well, the first thing I do when I ask anybody when they're on this is, what's a 9 to 5 mean to you?
A 9 to 5 to me means just pretty much working hard every day and making ends meet, I guess you could call it. But what I mainly see it as is a job for like a short term for a long term problem. Meaning like you're always working hard, but you never see ends. Like for example, me, I work 2 jobs just to make ends meet, to pay all my bills and everything else. But many would say it's like a career job, but it ain't a career until you actually love what you do. Whereas for me, I love what I do, so I don't see it more so as a 9 to 5 if you have you, but for the most part, just for day to day, 9 to 5 is just mainly going to work, trying to pay your bills and do what you got to do, learn how to save, budget, all that great stuff.
Yeah, I agree with that. So with that, what is your current 9 to 5?
Well, my current 9 to 5, I work at a full-time drug and alcohol rehab facility, and I also work part-time as a mental health associate at one of the hospitals. So both jobs are great. Can't complain about them.
So the first one, can you repeat that one?
The first one is a drug and alcohol rehab facility where I work with adults struggling with addiction.
Okay, and your position?
I'm an orientation counselor, former TA, which is also a treatment associate.
Alright, cool. So for the people who might not know what that is, can you like break that down?
Alrighty, so for the treatment associate, where I was in the past, it was basically just working with the people who are struggling with drug and alcohol addictions, hands-on, trying to work with them and help them as they're getting into the treatment process of their recovery. Mainly seeing them, they live at the program as a short residential program. Now I'm an orientation counselor where I just orientate the patients or clients.
So how do like people get to that point? Like is it just like if they're on alcohol, it gets really bad and they end up in there? How do they end up there? Like if you can.
Right. Say for instance, an addict or alcohol is sick and tired of being sick and tired. They call the number to our program, and we just get them in if we have a bed, because there's always beds, but some of the beds are always filled, so they gotta constantly call at times. But as soon as we get a bed provided for them, we get them in and get them started with their process. So, some of them may go to detox. So
if I'm an alcoholic, I have to call the number?
Yep.
I call the number and then they just hook me up with a bed? So, yep. Okay, so and then...
You go through a screening process, and as you go through the screening process, they start the process of getting you in, which is calling, asking you a few questions just to know where you're at, where you're coming from. We serve pretty much Monmouth County, Ocean County, Essex. We've served a whole lot of counties, many of them, so I don't think anyone is excluded. But definitely, you just call the number, we start the process there. And when you're ready, they give you your time and date, and you come on in. Whether you're clean for a few days, because if you're not clean, you come in so intoxicated, they'll have you go into detox.
So you just go in there and sober up really fast?
The detox part is sobering up pretty much, as you say, really fast because it's a detox. But then if they want to go into rehab, where that's more of the, you can be there from 14 to 28 days.
Is that their choice to go into rehab? So what about if like when you guys feel like they don't need it or need it? It doesn't even matter. It's their choice. Their
choice. Like if we encourage them, we can encourage anybody to stay. But if they don't want to stay, they have to. We try and set them up with outpatient, just aftercare on their own, so that way they can at least know that we are in support of their decision as well, and we're not leaving them high and dry. But they do have where some come over to rehab, and once they go over to rehab, they start the process of going into treatment, starting the program, getting therapeutic assistance through their counselor and other staff as well. to help them along the way, and start the process of just treatment, focusing on where they're at right now, and then eventually when they're getting close to leaving, we start working on their discharge plans and just start figuring out where they want to go next. Some may go to another long-term program, and some may go home and just start IOP, which is IOP is inpatient out. Sorry.
Yeah, you good.
It's basically intensive outpatient program.
So what if somebody that went to the rehab, but you see, like let's just say you guys see from a distance that they still need help, but they're saying they don't need help. That doesn't even matter. I know you answered, but so they have to walk, so they can just walk out the door, even though that y'all see, even though that they still might need help.
Right. We can encourage them as much as long as they're not ready. If they're not ready to go move on to another long-term program, or there's other programs out there such as sober living, halfway house. So wherever they choose to go, they can go home. We won't stop. We can't stop them.
Yeah, really, I get that. But how do you feel about that though?
If we want to help them?
Yeah, and that you can't, like, you've seen somebody who obviously need the help, but they walked out the door because they're like, I don't need it.
It does sadden the heart, but eventually, when we pray that they're able to come back, but if not, we hope the best for them, and maybe our program will help them, maybe another program along the way would help them, but for the most part, it's always sad to just see them go when we know they may not be ready, or they're not showing that they're strong enough to go out there. I mean, going to through detox, it's like 3 to 7 days at the most. So after 7 days, if you have an addiction, I can't say that the addiction is automatically over. Like, you're still going to have the cravings, and if you haven't fully and truly worked everything that you needed out, you're going to be struggling, because what happens when you're off the medication that you were on to detox? What happens when you're trying to find another coping skill, but you can't right now? Like, many of them leave and say, no, I know what I have to do next. I have to go to a program, I have to go there. But most of the times it's like, okay, yes, you have to go. You know you have to go, but where are you going to go? What are your plans? So we try and help them even as they decide to leave, to set up a discharge plan for them. Like, if they say they're leaving right after to go home, then we try and set them up with programs outside, such as going to a meeting, or just meeting up with one of their sponsors that they have. Those are the main things we try and encourage them to do. Okay. But yeah, we just hope the best.
All right. So, what is some of the things that, like, the general public doesn't see about that job? That you would say.
I would say it's mainly just always how the staff go hard for them. Like, of course, but as the clients are going through what they're going through, they may not see the brighter side, or they may not see how we're helping them, and they give us a hard time. And it's like going word from mouth. Once the clients leave, they do share with other people who are struggling and say, man, I don't like this place. They didn't do this, they didn't see that, but they don't see the behind the scene work that we're doing for them. Or even just like as they come in surrendering, saying they're tired, structure is now put into place. And many people don't like to be structured or be told what to do, in their words. So it's like always just trying to be consistent with them and put the plan forward with the structure that they need. But most of the times, it's whether they want it, they're going to receive it. If not, then they're going to do what they do.
So do you think you guys get the recognition for dealing with the patients?
The recognition, I would say.
I know it's self-fulfilling. Yeah. Let me ask you this: is this a job that you think you should do for the money, or you generally have to have a passion for it?
Absolutely. I would say money isn't the answer. If you're coming for just a 9 to 5 and trying to get a check, then that's not the place I would say to go, because you're dealing with different people. You're dealing with many personalities, and now it's a behavioral health, so it's always just a way of dealing with many different situations. Because they may be dealing with drug and alcohol, but they may have underlying mental health as well. So you're dealing with a lot of situations. So if you're coming for a check, that's not a place to go. You gotta be really passionate of what you do. Where I would say I love what I do, and I've been there for 6 years. So
what is the hours there? 'Cause I don't feel like that's a 9 to 5. It gotta be. I feel like it might be more.
Yeah. It is more, depending on days. Some days you can have the 9 to 5, and some days you'll be staying a little bit longer. Sometimes I see myself staying there 9 to 10 hours. So
and that's exactly why you gotta love that job, because any job that going over, I don't think you could stay if you're not really,
right.
You know what I'm saying, like really connected to the job. So that's a reason that if you're thinking about doing the job, you shouldn't do it unless you really care, because it's going to be more than a 9 to 5. It's not on call or anything like that, right?
No, certain people have on call, but for me, no, I'm not on call per se.
Okay. So what's the one of the wildest experiences that you had that you can say? I gotta get.
Yeah, I was gonna say wild. It's always wild there. It's never a dull moment, I should say. But it's always just, I would say one of the hardest is just, or wildest I would say, is just leaving when you're not ready. Or as you know, some people struggle with addiction, so they can be having highs and lows. So depending on the day, it could be just one great day, everyone's listening, or it could be where there's always chaos every time you turn. Of course, it's a facility with a lot of people. Sometimes people get, angry towards one another. There can be arguments, altercation, but nothing too crazy, I would say.
Okay. Let me see, because it sounds like it gets a little bit intense at the job. So, do you feel like you guys are protected there?
Yeah, I would say we're protected because we work as a team, and as soon as we see other things may happen, we try and pull each other up and let each other know. Communication, I would say, is the biggest thing, and we do that great at the job, especially when there's a situation where it may get intense or someone's not seeing eye to eye. We always have like little sayings if we need more help, or I would say just assistance, and it may not be a big issue, but just if we need assistance, we'll call a code and we'll have backup immediately. So we're always there to assist one another, communicating what's going on from the start of the problem to the end. So I would say definitely just communication and debriefing one another with what's going on. We get the job done.
So this is like a team. So this isn't an I team.
No.
Okay.
You can't be I team there, no.
All right. So the second job that you do.
That is working at a mental health facility with adolescents.
With children. So how was that?
Again, that's another challenging job. Not challenging, I won't call it challenging. It's just another job dealing with many different personalities, and now it's a little harder because they're children. They're more, impulsive and more alive than anything else. So I would say, for one disclosure, I love what I do, working with the kids and seeing what they're going through, and being able to help them. I wouldn't mind going there. Because it's always, what's the job when it's never like a dull moment? Like, I go to my job and I'm like, okay, there's never a preparation moment. You just go in and see what's going on for the day, and you try and work through it. Okay,
so how does a child end up there? That's what I don't have no clue.
It's tough with the kids. You can't really say how or why, because there's always different situations. Some may come because they're feeling down or depressed, or some may come because they just don't want to be. Right now, lately, during of course COVID, some people are just coming just to deal with just the anxiety and depression of what's going on in the outside world. But
the kids?
Yeah, you would have never thought that there were kids dealing with depression and stuff, and just life on life terms as well, like dealing with traumatic
COVID,
situation.
Like they're dealing with COVID, like they're depressed. They're saying they're depressed because of COVID.
Yeah, some of them can't go out, so it's a struggle. Yeah.
Yeah, that's crazy. So what about the parents? Like, how's the interaction with the parents and you guys?
They're great. They're supportive of what we do. They're actually grateful that we're there to assist them and help the kids as they go through what they're going through. Because there are some that does have mental health and struggle with a lot of situations and trauma. They're even just going through their day-to-day life, dealing with bullying and just peer pressure. Sometimes it just brings a lot on them. So the parents are really just happy.
What is the age range?
It varies. It could be from 9 to 17.
To 17? That's almost an adult. It's basically an adult.
Yeah.
So what happens when you get into like when it's like an intense situation with a 17-year-old? Like, you know what I'm saying? Because that got to be a little bit different from.
It's tough because you never want to have an issue with the 17-year-old one because they're more athletic than most of us nowadays as we're growing and they're getting there. They are more energized, I would say. But it's always just paying attention, being observant to what you do, monitoring the patients, and just making sure that you're safe and everyone around you is safe. Because our main thing is monitoring and safety. So we have to make sure the kids are safe, but then also making sure we're safe. So we'll call like security if we need to, because I do work at a hospital, so there's always security, and we always inform, and again, communication, letting all the other staff know, the nurses know what's going on with the patient. So we always try and just teamwork and make sure that everyone get out safe, because dealing with mental health, some people are more impulsive, some people just deal with all the other illnesses. Like there was one I didn't even know was in a, I would say, a disorder, which is intermittent explosive disorder.
Intermittent is
explosive
disorder. Okay,
yeah.
I got it.
Me, I thought that was just another word for like behavior, but it is really a thing, and there's a lot of people that are more impulsive than others. And
But you gotta say what it is. You can't just say the word. I got it 'cause I don't know. What is it?
What is it? Intermittent.
Yeah, I don't. Yeah.
It's just a behavior where kids are acting out. They are more impulsive than others. Where they're, say, for instance, you have me. I'm willing to, like, we are daredevils, like, or we'll go skydiving. Whereas them, they be like, okay, I'm gonna jump off a bridge today. If nobody's listening to me, I'm jumping off a bridge. So it's like, whereas us, we're planning. Them, they're just going and dealing with it.
So do you feel that's a real disorder? I feel like they just diagnosed that with that because that just sounds like.
I mean, we can never say what's a disorder or not, but me looking at it, I would say it is, because a lot more people are coming in with it. Like, especially the younger kids, because they're more explosive, more than we'll sit back and think, but they are just like, no, this is it.
I do believe that because you know what I seen. I remember when the ULYSSE came out. And everybody looked at, you know what I'm saying, they looked at it really crazy.
Yeah.
Now it was more acceptable that with the ULYSSE.
Right.
So I seen that, especially with like a lot of black people too, because the black people wasn't even cool with it.
Right.
And now I see more, especially more parents with it now
Absolutely.
too. So I believe it, but it's like shocking to me at the same time.
Yeah, it took me a minute to even digest that it was something, because for a while I'm like, that's just a child acting out. Like, that's not a behavior or disorder. It's just them trying to get a feel of who they are and dealing with identity.
In your opinion, is that different from a child acting out? Like, is it two different things?
I would say yes, absolutely, because whereas there's some kids you can will back in, the kids with the intermittent explosive disorder, they tend to just react without even impulse, and at this point they're not listening to you. They can't hear you in there until they come out from that rage that they're feeling.
See, that's a different thing though. That is different. Yeah. So is there like 16 and 17-year-olds with that also?
It depends on the age vary. There's no age on here. It's just sometimes it's 12-year-olds, 17-year-olds.
Because now I'm saying, because if a 17-year-old, you know what I'm saying, athletic frame, you know what I'm saying, enters that with that, then that's the whole. You know what I'm saying? That's kind of crazy.
Absolutely.
Like, so then I would have to ask the same thing. Do you feel protected there? Because that has to be a little bit more different. I would assume it's different.
It is. It's definitely different because whereas I work at the other job, it's not hands-on. At the mental health facility, it is. So we have to try and help them calm down. So sometimes we may have to do therapeutic holds, and if it gets worse, we have to try and get to the panic button, because once we hit the panic button, more staff comes down and security comes down, and then we have to sadly put them in restraints if we have to. But most of the times we can just calm them down through a therapeutic hold.
So what are the restraints?
Restraints are
like another thing too, like the site where, you know, people stereotypically would think it's like, you know, the mummy suit. I don't think it's that.
No,
you know
it's
what
not the mummy suit.
So,
no, it's just I would say they're like straps that we put on their arms and legs where they can still move, but it's just for their safety. We have to put them in restraints, and it's tough at times, but sometimes, again, as I said, we don't normally do restraints. I haven't done as much as like 3 since I've been there. I've been there for 3 years, and we have our ups and downs, of course, but again, just talking to them and trying to get them de-escalated before they get to that stage, it ends up working better. It works well, and not having to restrain them, that's always a plus, because just talking to them, sometimes they just may need a conversation, so just talking to them and wheeling them down helps, but then if not, we do the therapeutic hold, which is just holding them for a few minutes until they're able to calm down and come back, or sadly, restraints, which we don't like to do as much at all.
Nah, that doesn't sound too bad though. I mean, you have to do that. Either that or you don't want to get injured.
Absolutely.
And then if you get injured, then there wouldn't be no point in the whole situation. You know what I'm saying? So like, I understand that. So what are like some things that people don't see? I don't even know if people. I'm still gonna ask them. But what is like some things that people don't see about that job?
I would say not seeing, more so. Never thought about that with that job, because it's kind of like an open door policy with the parents and everything. Like, we call them whenever we have to put them in restraints. We call them when they're acting out. So
I would guess. I guess the real thing would be when a child acts out. I guess the process from them acting out and they call the parent, because the parent wouldn't see that, because you have to call them when they're acting out. So I guess the intensity of them acting out, you know what I'm saying? Like, how is it with, like I'm saying, if you're restraining somebody, you know what I'm saying, then a parent come in, I mean, no, y'all restrain them till they calm down.
Till they calm down, yes.
And then y'all contact the parent, or you contact the parent during?
Well, once they calm down, because at that point they're being restrained, we call the doctors, so the doctors will come up to evaluate and make sure everything is okay. Once the child is either in the restraints, we contact their parents, or after the whole situation, when we know for sure that the patient is calm, we'll go back and contact the family and just let them know like everything that happened and what led up to the restraints as we had to do it. But for the most part, we don't contact, I would say, more so till after, because we could take them out and then after that we have to bring them back into it. So we always just make sure the scene is safe, the patient is safe, and then we call the parent just to debrief everything with them.
Okay, so how did you get into that line of work?
It was right after college. I needed a job, and I had one of my friends working there, so they got me in. I did the interview. I was a home health aide before, so it helped with like working with dementia people and stuff. People with dementia, it worked out. So after I did that, I went in an interview, explained to them, and getting my bachelor's helped as well. So when I walked in, I had my bachelor's, and they decided, okay, we'll give you a shot. It was funny because I didn't think I'd see a year there, but I'm now 6 years in as a mental, working at a drug and alcohol facility. So yeah, that's what really brought me in there, and it's different. It's literally life on life's terms. You get to see the ins and outs of just people struggling, because before I never really seen how bad the drug and alcohol really affected our community, just our society. And now working there, it just really opens your eyes, and hearing their story and their trauma that brought them or caused them to start using is just an amazing thing to see, and also a sad thing to see, because it's like growing up, you don't ever think you'll see people struggling, and hearing their story and just going in depth of their storyline of what caused them to start using. It's just wow.
So just like an estimate, because you're probably not going to know the actual number, unless if you ask, that'd be dope. But how many people that you think you actually interacted with or heard their story about trauma and alcoholism and drug abuse?
I would say thousands, because it's an in and out program. So you see, when one person's leaving, another person's coming in, or midway into their stay, someone's coming in. So it's always just like many people coming in stating that they need help.
So how was it through COVID?
COVID, we had to change a lot. A lot of people couldn't come in. When it was really bad, COVID was the outbreak of COVID, the pandemic. It was just like sad because many people were calling and we had to turn them away, sadly, or turn them to another option. But for the most part, it was just sad. And we had, I would say, on our census, we had about 30 people able to come in when we can normally house roughly about 200 people, both the detox, the rehab, and the upstairs program. I would say 150, 200, 150 to 200.
That's a lot. That's a big difference. So is it? Is it more people now that it's like? Well, it looks like the phases, everything coming back to normal. But is there more people calling now than it did before?
Yeah, it never stopped.
But now you can't see everybody now. Well,
now we can't see as much people,
but it's still more people calling.
Yeah.
That's got to be.
Yeah.
That's kind of crazy. So when it gets back, if you had to guess, do you think it would be more people
coming in?
Yeah, because you can't see them. If some people, it's better to physically be hands on when they need help. So if they physically can't do it, they have. I don't know, but I'm saying I guess they will call or something like that. So or they're gonna have a line to wait. So in that waiting time, they in limbo, but they need a problem. So when everything, hopefully they deal with it until then, or they get seen. But it's like if it's an increase in people who needed it because of COVID, but it's a decrease in who you can see, or it's a limit. So by the time it comes back together, it might be a lot of people.
Yeah.
You know what I'm saying? So that's why I'm just thinking about it in real time right now, because it's kind of crazy, because I didn't think about the people who need help in COVID, because we hear about a lot of stuff, even doctors, though we can't really see them directly, but people still need help. You know what I'm saying? So it's
for the most part, it's the ones who come into our facility, we help, and the ones who can't come in at the time, we direct them to another agency or another program that offers the same assistance that we do. And if not, they'll probably go to the hospital, or some even just go home and try and beat the odds for themselves. But for the most part of just having them come into the facility, we approve them, and as they come in, we also do a COVID testing for them as well, just to make sure that everyone that is coming is COVID free. Because for the adult unit, we have about 4 beds for isolation, meaning they're in their rooms if they tested positive, or if they come in and they start to feel ill and they have some COVID symptoms, we'll put them into the isolation room and we'll let them stay there until the 14 days of isolation period is over. But I would say the one thing about our job, we really have been taking just the proper channels, because we have nurses as well on the unit, so they work 24 hours, 7 days a week, so we always have staff for nursing and just our staff period. So I would say we've done well. We haven't had any situations with COVID. Anyone who's come with COVID, we direct them to either a hospital or they go home and isolate.
Alright, so let me ask this then. What's one of the best experiences that you had there?
One of the best experience, I would say, is we have a medallion ceremony every 90 days. So seeing someone coming back, having over 90 days, not just starting the program, but going and having 2 years clean, that's always a great thing. And there's one client that I started working with when I first started working there, and she came constantly, and now I can say has 3 years clean, and that's just always an amazing thing, hearing their success story and seeing them stay clean and doing what they need to do and being drug free. So that's always one of the greatest.
Oh yeah, that's dope. So before I wrap this up though, I asked a 2-part question. Is that job what's the mental toll on that job? I feel like it's a lot.
Whew. It is a lot. I won't say it's not. It definitely is. Just dealing with people day to day. You gotta be hands on. You gotta be patient, you gotta be understanding, and just meeting them halfway or meeting them where they're at. So it's always just a tough time at times, but then there's great times. And also just make sure you have your self-care days and taking time apart and you reflecting on yourself, so that way you won't get the burnt out stage, because some people do burn out, and I see it and it's like, wow. But as long as you constantly take your days and deal with your mental health and make sure that you're okay, you should be great.
Okay, so if there is somebody who has the same job, same hours as you, but they don't know how to deal with the stress of the job, what would you say to them?
I would ask them, number one, what are you here for? Is it for you or is it for helping? Because number one, you always have to just make sure that you're doing it for the right reasons. Because if you're not doing it for the right reasons, you will be struggling and not being able to understand what the client is going through a certain day, where they're having a tough time, or just having a situation to where they're wanting to go use, and they're having the craving and they're ready to walk out the door. If you don't have it within you to talk them out or help them through, then I don't know what you're doing there. Because it's always having a face-to-face moment with them and trying to help them through where they can't see, where they're, I would call it their blind side. Like, they're in tunnel vision and they can't see their way out, and all they can focus on is going to get the next fix or going to get a drink. So it's always just like you trying to help them remember what caused them to come in the first place. Because some people struggle, some people are ready to just surrender, but sometimes when the cry for the drug is real, and when it comes, it's like they're not hearing you, they're not seeing you, but giving them that time to separate. So telling that person next to me who's doing the same thing as I am, just take a moment, step back and see what's going on with yourself, and if you can't help them, then maybe this is not the option or job for you.
Alright, so and then my last question is, what do you do to release some of that stress, that mental stress? Like, what do you do when you're not at your 9 to 5 to, you know what I'm saying, separate that from?
Mainly just making time for friends, family, staying at home sometime and just taking the mental health day for yourself. And I read, I try and, my new hobby is now trying to sew and painting, just doing daily self-care. Just like taking yourself away from the work, the job.
Yeah, so the important thing that you said is the mental health day, though. That's no matter how you do it, so you just need a mental health day.
Absolutely.
That's basically, that sums all that up.
Yes,
so,
not talking about jobs, not talking about anything about going to work the next few days. No, just taking that day and just doing things that you like to do, having fun.
That I agree. So if you're at a job and it's stressful, you need to take a mental health day, regardless of how you do it. So I think I'm going to wrap this up. I appreciate you coming through.
No problem.
And like I said, this is What's a 9 to 5 podcast. Just rock with me, man. Appreciate you again.
No problem. Thank you.
All right.